Hello everyone, how are you doing today? It's Debbie with Fundamental Physical Therapy and Pelvic Wellness. I want to talk with you today about something I get asked about all the time, which is yoga. Yoga is an amazing way of calming your mind, exercising your body, and just having a great night's sleep, getting all kinds of benefits out of it. Unfortunately, there's a lot of controversy been springing up around yoga more and more in recent years, and some of it is well founded. So I thought I would try and address some of the concerns, dispel some of the myths, and let you know how you can get the most out of your yoga practice in the safest way. As a pelvic physical therapist, I see people a lot of times who have pelvic pain. That could be pain inside their pelvis, in their genital areas, in their rectum, all kinds of things that are kind of unmentionable, and so they don't want to talk to just everybody about it, but they end up talking to me. And since these kinds of conditions often come with other orthopedic problems like back pain or hip problems, they're also interested in taking care of those through exercise, stretching, doing something good for their whole body. And as well, these conditions also often come with a lot of stress and psychological effect. And yoga has a lot of publicity, and for good reason, about being able to help you to reduce stress and feel better mentally, which is a big part of reducing pain, especially in people who've had pain for a long time. So I'm a big advocate of whatever helps with that. And as you may know, there can be some risks to doing certain kinds of exercise without the right supervision or without the right approach or mentality. And there's a new study that just came out recently in the Journal of Movement Therapies and Bodywork saying that of people who were practicing yoga, 10% of people were experiencing new pain as a result of their yoga practice. Somewhere in their body they had new problems, and the most common area was in the upper extremities. That would be their wrists or shoulders. And with people who had already existing injuries, a full 1/5 of these existing problems had gotten worse with yoga. So what's going on here? If yoga is such a great thing, why are so many people having new problems or increased pain with it? Well, it starts out with an approach and a mindset, and some of it comes from the issue of what is our definition of yoga. You know, when you go to a class and say, I'm going to do these postures and positions, and I'm going to go with this yoga teacher who has, so it sounds like a great training and certification. I'm going to go there and I'm going to be doing yoga, so I'm going to be doing something good for myself. Maybe, maybe not, and a lot of it depends on where your body is starting out at this moment relative to what you're going to be called upon to do in a class. There are always risks and benefits of anything you undertake, and usually when you take a group of people, not everybody is going to be starting at the same place and in a position to do all the same kinds of things without any modifications. So a really good class with a really good teacher would involve being able to talk to the teacher beforehand, let them know that, hey, I have this kind of issue going on, I have a painful hip, or I have an issue with my wrist or my lower back, and a good teacher will be able to keep an eye on you and help point out for you how you might have an option of changing the way you're doing a certain position or a yoga posture in order for it to be a good thing for you and not increase pain. A good teacher will also make sure that you're comfortable, that everybody is feeling comfortable with what they are doing and not pushing through pain, not feeling as though pain is a sign that you're doing something good, but rather it is a warning sign that maybe you want to change something and not expect that it will just get better or just go away, or that it's actually might be a good thing to be experiencing pain, which unfortunately is a mentality that's out there, is rampant, and is not very helpful for getting better, especially if your intent is to be doing yoga in order to get rid of pain. So if you have a specific injury that you're trying to treat, step one is really to get it evaluated and treated by a medical practitioner in the healthcare system, such as a physical therapist, perhaps your MD, perhaps an orthopedist. Get a good medical team on board to make sure, in your specific case, is there a diagnosis that needs to be treated in a specific way. And if all that's been cleared out, or you're just trying to address general health, feel good, have less stress in your life, that's all great. Yoga is wonderful for that. And what's also important is to realize that yoga is not just exercise. It's not just a series of positions and movements to get into, and treating it that way is part of the problem also. It's an ancient methodology that is first and foremost a philosophy, and it's a mindset that goes along with using the breath and breathing techniques in a specific way along with physical movements and postures to achieve a certain mind, body, and spirit improvement. So if it's doing that for you, great. And the way to get that is to go into it with that mindset, that it's not simply with a goal to even improve strength or flexibility, even though it may do that. So it can be a wonderful thing if you approach yoga with a good, forgiving, positive, playful, fun, enjoyable way of going about it. Make sure that that's what's going on and that it's not hurting you, making you feel worse. If so, do something different. Stop, talk to the teacher, talk to another medical professional, and reevaluate what you want to be doing in order to get healthy. So I hope this helps. Please feel free to ask me any questions anytime. Shoot me an email at debbie@pelvicwellnesspt.com, and I'll talk with you again soon. Enjoy moving your body in any way that you like.